Hi, in this video, I'm going to discuss a common reason why adolescent girls are referred to me. And that is when they think that their labia or the lips that surround the vagina are too large. And by adolescent girls, the common age is thing from 14 to 17. Why do they come along? Because usually it's because they're concerned about the appearance of their vulva. But also they can get soreness from rubbing of the labia, and as often the case, they're worried that if anything is wrong and what can be done. So stay tuned to find out what we do in these cases. But before we go to that, let's have a recap. So the labia are the lips. There are two pairs of labia on either side of the entrance of the vagina. The labia majora, or the larger ones, are the ones that bear hair. And the labia minora, which are usually ones that cause concern, are the smaller inner ones. And they're the ones that are sometimes worrisome to girls if they think they're too large. Now, just to reiterate about puberty. Puberty is a time of gradual development and change in the body from a child's body to that of an adult. Of course, alongside the physical changes, there are mental, emotional, psychological changes as well. Some developments in puberty are pretty obvious. For example, the growth spurt that happens, hair development, breast development. These are obvious signs of puberty and the progression of puberty. Some things that are happening in puberty, however, aren't that obvious. For example, the growth and development of size of the womb, the strengthening of the bones, and thirdly, the development of the vulva. Now, in terms of the development of the vulva development, like development of everything else, goes through stages. So, for example, with breast development, we have 5 stages of breast development. So, when we talk about breast development, the obvious thing is that the breasts increase in size, but less obvious is that they also change in shape until the 5th stage, which is the fully mature adult breast. So too, the vulva goes through sort of stages of development. And initially, the first stage of development is that the labia minora, so the inner ones, the smaller ones, and that's the one that we're talking about today, they actually develop and grow first. So it is actually normal in the first part of puberty that the labia minora, or the smaller lips, are quite prominent and they can protrude. As puberty continues, the majora, or the larger ones, the ones that have hair on, they become filled with fat and they envelop the smaller ones. So actually, the appearance of the vulva early in puberty can be quite different from at the end of puberty or in the adult female, in that in the early parts, the smaller lips are quite prominent, but later on, the larger lips become more prominent and they kind of enclose these smaller lips, make it all look better proportioned. As a result, although many girls come along seeking surgery and a labiaplasty, which is what the operation is called, when we reduce the size of the labia, this is something that we do not offer to girls under 18. The reasons for that are significant. The first reason is that with any operation, there can be scarring. The second reason is that the growth and development of the labia actually isn't complete at that time until she is an adult at about age 18. Therefore, the labia are still growing and still developing. So if you imagine that we go and operate on these labia and then they grow further and then there's scarring as well, the labia can become quite puckered, asymmetrical, so therefore different sizes one to the other, and they don't look normal. So for that reason, we allow puberty to be complete and development to be complete before that should even be entertained. And actually, by that time, because the development is complete, often the girls are quite happy with their labia because now the vulva is now in proportion. The other issues are potential, as I said before, scarring, perhaps pain during intercourse, and perhaps loss of sensation because the clitoris is richly supplied by nerves, and some of those nerves also supply the labia. Therefore, cutting skin means we cut nerves necessarily, and therefore that might affect sensation. The analogy I give is an adolescent, maybe a girl of 14 or 15, going to a breast surgeon because she was unhappy with her breast development. And if she went seeking surgery, such as breast augmentation, I can't think that any breast surgeon would agree to this. And the reason for that is that she hasn't finished her growing, she hasn't finished maturing, and therefore the breasts that she has at that time is not the finished article and it's not the mature breasts. So that if she has surgery, breast augmentation, say implants, and then the breasts grow subsequent to that operation, then it's quite likely the breasts will have an asymmetrical or uneven appearance, and they may also look quite wonky just because of the growth that's occurred. So for that reason, I'm pretty sure that they would wait until the girl reaches full maturity before breast surgery is entertained. So too, vulval surgery should not be performed before age of 18 or full maturity. So what do we do? What can these girls do? Because yes, indeed, apart from the parents, it may be a problem. Maybe saw things like activities like, I don't know, bicycle riding, horseback riding, things like that. Perhaps the labia will get in the way, but maybe it makes these activities a little uncomfortable. So discomfort is what we're talking about, rather than pain. Sometimes if the labia are large enough, we recommend that they tuck the labia actually into the vagina, and therefore that protects them from compression or friction. Sometimes these girls have shaved their pubic hair, and that therefore means that there isn't that cushion or divide between the labia and, for example, underwear. So allowing the pubic hair to grow may make things less uncomfortable. And lastly, they can use emollients such as hydromol ointment or pseudocreme, things like that, just to lubricate the labia and make them less dry and therefore less subject or vulnerable to friction and soreness or pain. Basically, like many things during puberty and adolescence, the body knows what it's doing, and whatever effects are happening at the moment are usually transient, meaning that she'll come out the other side and usually be happy, and usually things will settle down. So the take-home advice is patience, because at the end of the day, the thing that will really sort this problem is a bit of time and maturity. So thank you for watching. Don't forget to like this video and subscribe to my channel in order to improve circulation and increase awareness of this pretty common problem that does cause significant worry and anxiety to girls. Also, please join us on my Facebook group, Gynecology Girl Talk, where we're free to share our experiences, get opinions, and basically be in a safe, secure community that is supportive. Thanks for watching. See you soon.